Okay, let's dive into this. Welcome to today's explainer. Navigating fertility challenges can honestly feel like you've suddenly been dropped right into the middle of a maze without a map. And that's especially true when we're talking about male fertility investigations, right? The medical jargon alone can be totally overwhelming. But today, we're going to gently guide you through this process. We're breaking down the science and the procedures into clear, structured, and really easy to understand insights straight from the medical experts. My goal today is to empower you, replace that fear with understanding, and help you realize that you have some very clear, manageable options ahead of you. If you or your partner have recently been asking what happens if an analysis shows very low or no sperm, or if you've actually received that difficult result yourself, I just want to pause for a second and validate exactly how you might be feeling right now. It is incredibly common to feel a massive wave of anxiety, shock, or even grief. It feels like a roadblock. But I want to reassure you right out of the gate, a difficult semen analysis is absolutely not the end of the road. It's really just a data point. It's a signal pointing your medical team toward the next logical step. There is a highly structured, totally manageable medical pathway forward, and science has advanced so incredibly in this field to help you build your family. So let's move into Section 1, Understanding Your Diagnosis, and why doctors might recommend further steps to investigate the absence of sperm in the ejaculate. When there's a low or zero sperm count, doctors don't just stop there and give up. They need to investigate exactly why this is happening. And when it comes down to it, fertility problems of this nature generally stem from one of two main causes. First, it could be an abnormality in sperm production itself, meaning the body just isn't manufacturing sperm the way it usually would. Or, second, it could be a physical blockage. You can kind of think of it like a factory and a highway. Either the factory isn't producing the goods, or there's a roadblock on the highway preventing the delivery trucks from getting out. Identifying which of these two issues is happening is exactly what the next step in your medical journey is designed to figure out. Moving on to Section 2, what is a biopsy? So the crucial point is really about demystifying the medical procedure itself and stripping away all that clinical fear. The word biopsy is one of those clinical terms that can instantly trigger anxiety, for sure. But if we break it down, a testicular biopsy is simply a procedure to gently extract a small tissue sample from the testicles to collect sperm for treatment or to diagnose an underlying issue. It's actually a brilliant dual-purpose tool. Your doctor is using this straightforward procedure not just to find answers about a potential blockage or production issue, but to physically gather the exact sperm needed to help you achieve a pregnancy. So it's both diagnostic and therapeutic at the same time. Let's look at Section 3, 3 types of procedures. Here, we'll see the specific approaches a doctor might take, carefully tailored to your individual needs. And this brilliantly illustrates how these options range in approach and invasiveness. First up is testicular sperm extraction, known by the abbreviation TESE. This is an open biopsy requiring a small incision to take a tissue sample. Next, we have micro-TESE, or microscopic testicular sperm extraction. This one uses a special microscope for a highly targeted, less invasive approach. And finally, TESE, which stands for percutaneous testicular sperm aspiration, uses a needle to simply aspirate, or draw out, the sperm with no incision made at all. Because these options range from gentle needle aspirations to minor incisions, you can rest easy knowing your doctor will choose the least invasive, most effective tool for your specific anatomy. Now for Section 4, Outcomes and Next Steps. Let's shift our focus toward hope and what happens immediately after the procedure is completed. Following a successful procedure, you embark on a very logical step-by-step journey toward building your family. Step 1 is that gentle extraction we just discussed, gathering the sperm and tissue. From there, your medical team has incredible flexibility. For Step 2, they can take that retrieved sperm and use it immediately for fertility treatment if your partner's cycle is perfectly synced up. Or if the timing just isn't right, Step 3 allows them to freeze and safely store the extracted sperm for later use. This flexibility is huge. It takes so much pressure off of you guys, allowing the medical team to completely optimize the timing. Now, you might be wondering, well, what if the sperm they find in the testicles isn't fully mature? That is where a truly phenomenal scientific advancement comes in. Intracytoplasmic sperm injection, or ICSI, is a specialized treatment where extracted sperm, even in early stages of development, is directly used to fertilize an egg. What's absolutely amazing here is that ICSI completely bypasses the need for the sperm to swim to the egg or penetrate it on its own. Science is literally giving nature a highly targeted helping hand. I want to take a moment to really emphasize this point. If you remember only one thing from this entire explainer, let it be this. In cases of severe male infertility, sperm can often still be extracted from within the testes. A diagnosis of severe male infertility or a semen analysis showing 0 sperm does not automatically mean biological fatherhood is impossible. No way! Your testes might still be harboring exactly what is needed, and modern medicine has the tools to go right in and find it. This is a profoundly comforting and hopeful reality drawn directly from the medical experts. We've covered the why, the how, and the incredible science that makes all of this possible. So, I want to leave you with this final, important thought. Armed with an understanding of these procedures and possibilities, how will you use this knowledge to have an empowered, hopeful conversation with your fertility doctor? You don't have to be a passive participant in your medical care. You can walk into that clinic knowing the difference between TSE and TSA, understanding the role of ICSI, and feeling completely confident that a difficult diagnosis is just the beginning of finding a solution. Take this knowledge, ask the right questions, and take that next step forward with confidence. Thank you so much for joining me for this explainer, and I wish you the absolute best on your journey ahead.